Good evening, everyone, and welcome to our informational meeting for licensed providers. My name is Kathy Lago, and I'm the Executive Director of Solano Family and Children's Services. I want to thank all of you who are here participating in our second live webinar for providers. We took the plunge last night with our first try at making this leap into live webinars, and I think we're getting the hang of it. And we even gave you this really cool music. We really appreciate all your communication and questions regarding your child care services and how to navigate this difficult time. During this webinar, we hope that we'll provide some clarity regarding your roles as well as ours during this pandemic. Tonight, you have an opportunity to hear from our Resource and Referral Program Manager, Cinda Clemente, our Child Care Adult and Food Program Manager, Teresa Godfrey, and our Subsidy Program Manager, Diana Troach. If you're viewing on Zoom, you'll have the opportunity to send questions you have through the chat feature, and we'll open up phone lines at the end of this for those of you who would like to ask your questions live. I just want you to know we're honored to be providing crucial services that are essential to our community. Whether you've had to make the difficult decision to close, or you are still providing care for essential workers, you are our first priority. And we're taking every step to maintain the child care services and resources that keep you, the child care providers and families you serve, informed during this difficult situation. We wanted to make this webinar opportunity happen for all of you because we respect the work that you do, and we're here to support you. So thank you for taking the time on a Friday evening after probably a very long week. So now I'm gonna let you hear from Cinda Clemente, our Resource and Referral Program Manager, so that she can share some information about resource and referral and help me grow.
Good evening, everyone. As Kathy said, my name is Cinda Clemente, and I am the Resource and Referral Program Manager. Again, thank you so much for taking the time out to attend this webinar tonight. These are very trying times for all of us, and we are being forced to go about our business, usual business in unusual ways. For instance, as Kathy stated earlier, this is our only second attempt at using this media format to meet with our clients. Since we are still new at this, we ask that you please be patient with us as we navigate through this wonderful piece of technology. We want to assure you that we will do everything we can to answer your questions tonight, but if we cannot, we will follow up with you as soon as we possibly can. Please understand that at this time, we do not have all the answers to your questions, as the information we receive is very fluid and ever-changing. Also, we are recording this webinar, and we will be posting the recording along with all of the links to the resources covered tonight. So I will begin with a little bit of information for any parents that may be joining us. We know many families lost their childcare due to providers closing or limiting the number of children that they are caring for. And actually, I'm sorry, the screen that you are seeing right now, you can use the chat box to chat questions to us. It's at the bottom of your screen. And we ask that you please start your question with either subsidy, food, or R&R, so that we can categorize your questions and know who will answer them. The example here in blue is showing that this question is for R&R, as it starts with R&R. Thank you. The Resource and Referral team is working remotely, but continue to update with childcare providers in Solano County so that we are connecting parents with providers who are still open and providing care. Any parent looking for provider during this time can still contact us through the SFCS website and by filling out the childcare referral request form. Our website is www.solanofamily.org. A resource specialist will contact you within the hour of submitting your form. Next screen. The Help Me Grow Solano program is also working remotely, but is available Monday through Friday from 8:30 a.m. to 5 p.m. Help Me Grow provides navigation through resources and supports in Solano County. The Help Me Grow staff have been updating our list of resources in order to identify which agencies and programs in our community are still operating and providing service. We are also collecting weekly updates on which stores are having baby formulas, diapers, and baby items that parents have been having a hard time finding in the stores. We know this is a troubling time for us as adults, and even more so for our children. Help Me Grow Family Navigators can help parents with information and activities to do with your children that might help with some of their anxieties or behavior during this time. You can find this information and activities on our Help Me Grow Solano Facebook page. Any parent can receive Help Me Grow support and can reach a family navigator at the toll-free number 844-501-5437 or at the Help Me Grow website, www.helpmegrowsolano.org. Next slide. We'll move on to some information for child care providers for support and financial information. We understand that this has been a difficult time for providers. Whether you have decided to continue to provide child care for essential employees or to close during this time, please know that the R&R staff are still available for calls and technical assistance via phone or video chat. You can reach an R&R specialist for technical assistance or to update your status at 707-863-3950, extension 709, or through email at info@solanofamily.org. It is important that you update your status with SFCS R&R department. We have sent all providers an email and posted on social media asking you to do so. It's important that you update with us so that we have accurate information of providers that are open and which providers are closed when giving referrals to parents. The update form can be found on the SFCS website at www.solanofamily.org. Providers who have not updated with R&R by today, Friday, April 17th, 2020, will be taken off the referral listing until we hear from you. Next slide. It is also very important that you update with community care licensing. Community care licensing sent all providers an email through a system called Everbridge. We are told that this email looks like spam, but we want you to know that this is a legitimate email. Providers need to answer this and future emails that come through Everbridge from community care licensing, as they are required to know what child care facilities are currently operating or closed. I also want to clarify that this first Everbridge email was to clarify whether providers needed information in English or Spanish. So it is very important that you answer that email. Next slide. The California Child Care R&R Network is keeping an updated list of resources to help R&R staff and child care providers, which include guidance, question and answer documents, and many links to financial information for providers. You can access these resources at the R&R Network website at www.rrnetwork.org. Another helpful source is the Center for Disease Control and Prevention, COVID-19, for child care programs that remain open. This site offers guidance for child care programs, including additional options for screening children upon arrival to ensure that children who have a fever or other signs of illness are not admitted to the facility. And additional information that may be useful when personal protective equipment, PPE, is in short supply. Under the financial and business information and resources related to the coronavirus 19 for child care providers is the CARES Act. We are aware that the funding for the small business emergency business loan has been exhausted. I did find out yesterday that there is more help coming, and it's expected that California will begin accepting online applications for the Pandemic Emergency Unemployment Compensation, PEUC, program on Tuesday, April 28th. And the governor stated that applicants would receive money in 24 to 48 hours. This would be available to anyone who has lost earnings. So a provider can still be operating but caring for fewer children than usual and receive this funding. The provider does not have to be completely closed. Additionally, individuals may receive an extra $600 per week on top of the initial amount they qualify for. There are other sources of financial information that is not listed in this presentation. You will see some of those being posted through the chat box. I'll just mention them, and again, a reminder that these will be listed on our website and in the recording of this presentation. The first one is the Pandemic Unemployment Assistance page is at www.edd.ca.gov. I would also encourage you to contact the California Employment Development Department. That is at 1-800-300-5616. You will also see in the chat box information on America's Job Center for California, where EDD staff will work with partners to provide employment assistance. The CARES Act also includes a Paycheck Protection Program component that addresses the need for employers to keep meeting payroll without having to lay off or sideline employees during the COVID-19 crisis. For this purpose, you must be able to show 2.5 months of salary prior to COVID-19. The Paycheck Protection Program is offered as an incentive to keep employees on payroll for 8 weeks. It must be used for payroll, rent, mortgage interest, utilities, etc. This is only available through June 30th, and you must apply for this loan through your bank. We are also listing here a link to the COVID-19 small business relief programs and resource sites. This includes information and links to the Internal Revenue Service, Federal Emergency Management Agency, iBank, Small Business Finance Center, and more. Just in addition to the unemployment insurance component, if you are self-employed, a sole proprietor, or an independent contractor and are unable to work or have had your hours reduced due to COVID-19, you may be eligible for unemployment insurance benefits. This is funded by the federal government and could yield an additional $600 per week. We will continue to research financial opportunities and post on our website and Facebook pages. Next screen. As a good source of information and support, licensed providers have the opportunity to receive provider information notices, also referred to as PIN, from Community Care Licensing. The example shown here is the Provider Information Notice, PIN number 20-06-CCP. This PIN addresses social and physical distancing, guidance, and healthy practices for child care facilities in response to the global coronavirus pandemic, which was written in collaboration with California Department of Education. This guidance should be followed until June 30th, 2020, or earlier if written notice from the department. This PIN answers many questions that we have received from providers regarding social and physical distancing, teacher to child ratio and group size guidance, who to or can be excluded from your facility, including any child, parent, caregiver, or staff showing symptoms of COVID-19, and recommendations that child care facilities should follow procedures daily for self-screening for all staff, residing members in a family child care home, and children. This should include taking temperatures before arriving to work or beginning care. If anyone has a temperature of 100.4 or higher, they must be excluded from the facility. And also implement and enforce strict hand washing guidelines for all staff and children. I want to make note that this PIN also gives great ideas on how to talk to children about social distancing, practicing healthy hygiene, teaching, modeling, and reinforcing healthy habits and social skills, how to conduct visual wellness checks of all children upon arrival, and asking health questions when concerned, and also implementing procedures to frequently clean all touched surfaces. If you don't already, you can sign up to receive these PINs through the California Community Care Licensing website that is listed here, and again will be listed on our website. You can also contact Community Care Licensing at Rohnert Park, 707-588-5026, or for the Vacaville and Dixon providers, the Chico office, at 530-895-5033. Next screen. We have great news, and I'm sure you're all happy to hear that we have heard your feedback on needing cleaning supplies, and we have received some supplies already, and we have been given guidance on how we can use current funding to purchase more supplies. You should have received an email from SFCS through Constant Contact asking you to fill out a survey for the supplies that you need. If we can fill those items on your survey, We will call you with the location of where to pick those supplies up. Please note, you will have to show photo ID at the time of pickup. Many of you have attended our monthly snack and chat meetings before social distancing began. The snack and chat is an opportunity for all licensed and license exempt providers to hear presentations and learn from each other in more casual atmosphere. We will be hosting a snack and chat through Zoom next Wednesday at 7:00 p.m. The link for this meeting will be sent through email and posted on our SFCS Child Care Initiative Project Facebook page, listed as SFCS CCIP. The snack and chat will focus on how things are going for providers during this COVID-19 pandemic. The COVID-19 pandemic is a challenging and fluid situation. Federal, state, and local guidance are changing frequently. Please continue to check our SFCS website and our Facebook page for updated information. On behalf of myself and all R&R staff, we wish everyone health and well-being during this time of uncertainty and want to support you in any way we can. All right, we do have some questions here. If you did not receive the email regarding the cleaning supply survey, please call 707-863-3950, extension 709, to update, to make sure that we have the correct email address for you. There is still time to submit those surveys. Any provider that is looking to sign up for the SIP program or QIRS can also call the 707-863-3950, extension 709. And Joy Gamble will be in touch with you to let you know how to do that. And I do want to stress again that the snack and chat is not just for SIP or QRIS providers. It is for any provider that would like to join us. Capacity waivers. Yes, so the question is, if you have received a waiver to go over the capacity amount that you are licensed for, will it expire? Yes, it is only during this COVID-19 pandemic situation. So licensing will go back to your licensed capacity amount when the situation is over, and they will be putting information out of when that deadline is, or when that will take place. Disinfectant sprays and wipes are on the list that is sent through the survey for supplies. And that is it for R&R right now. Teresa or Diana, do you have any questions that you wanted to answer?
All right, since there aren't any subsidy questions yet, this is Teresa Godfrey, the Child and Adult Care Food Program. Hello, everyone. Thank you for joining us this evening. The food program staff are working remotely to process your claims and keep program information up to date. Please continue submitting your claims and your required documentation as usual, either online, through regular mail, fax, or you can still drop off forms in the brown mailbox out in front of our office. As you know, our regulations are a little different from the subsidy program since we're governed by the United States Department of Agriculture. So far, there's been no talk of allowing family child care providers to claim children that are not present for meal service. Several providers have asked if they will be reimbursed for meals the same way they are being paid for subsidized children who are not attending. This is not allowed for the food program. Please continue documenting your meals and attendance daily in Kid Care or on your scan forms, as you have in the past, claiming only children that are present and eating the meal. The California Department of Education has applied for waivers that affect child nutrition programs in our state, and the waiver that applies to our program is the nationwide meal pattern waiver. Next slide, please. The Solano Family and Children's Services received approval for the child care providers participating on our program to claim meals that might be missing required components due to unavailability. This waiver is in effect from March 27th, 2020 through April 30th, 2020, or until expiration of the federally declared public health emergency, whichever is earlier. So keep that in mind. It could be April 30th, not longer. This waiver allows for optional foods to be served in place of the following categories: the whole grain rich bread or bread alternate, the 1% or non-fat milk, or the cereals that do not meet the 6 grams of sugar or less requirement. So if you can't find any of those items when you're out shopping and they aren't available, you can substitute another item and still get credit. What you'll have to do is on your menu, underneath the food components, there's a box that says comment box. Please explain there which items are not available, and we'll give you credit for those incomplete records. If you use scan forms, please write a note on the calendar on the back of your blue CIF and the date that has the missing component. Next slide. We also need to track your availability. So if you need to close your childcare for any length of time, please send an email or call and leave a message stating the time frame of your closure. If you aren't sure when you'll reopen, just give us an anticipated reopen date. You can email me at tgodfrey@solanofamily.org, or you can phone and leave a message. My number is 707-864-4630. You also need to remember to contact Community Care Licensing and let them know if you're closed as well. Rohnert Park office phone number again is 707-588-5026. Or if you're in Vacaville or Dixon and you go through the Chico office, their number is 530-895-5033. We have all of the school district calendars loaded into Kid Care already, but we've updated them to show no school from March 16th through the balance of the school year. If you have children that are attending that would normally have been in school, you will get reimbursed for the snacks and lunches that they are in care for now. So it'll be just like when they're on a school holiday. Also, we wanted to let you know if you contacted Community Care Licensing about using the capacity waiver that's described in PIN 20-04-CCP, please send us a copy of the letter that you sent to them requesting the capacity waiver. And then we also need the approval if they gave that to you. We need to put that in our records so that we can change your capacity in Kid Care and allow for those extra children to be in care. That concludes the food program updates. Thank you. We'll pause for a few minutes to gather questions. And again, if you had any additional questions for me, please call at 707-864-4630 or email me at tgodfrey@solanofamily.org. Oh, here we go. There's one question for the food program, and they are asking if the sites that are closed, if we know if the CACFP will allow or reimburse for emergency food distributions for children. Right now, the child care homes are not being allowed to use that. It's only the CACFP that is in school sites. So they have that for some of their at-risk after school sites, and they are the ones that can reimburse or that can disperse food. They can't do it out of daycare homes right now. That hasn't been allowed in California. I know that that came up as a question on Kid Care, and Kid Care is nationwide, so they put that out for all states, but California has not asked for that for their family child care homes yet. We'll let you know if they do, though. That was the only food program question, so I will hand it back over to Cinda. Thank you, everyone.
First of all, I'd like to thank everyone on behalf of the Subsidy program for taking the time tonight to listen to this webinar. Despite our office being closed to the public, our Subsidy staff continues to come in to make sure our providers are paid on time and that our families' urgent needs are being met. So we'll start with a couple of very important statements. First of all, the information that I'm going to cover is based on our best interpretation of our funders' guidance. We have posed several questions to the state, but have yet to obtain some answers. If any of this information changes, we will inform parents and providers as soon as possible. The other important note is that the directives that I'm going to be going over expire on June 30th, unless they are rescinded sooner. Truth be told, they could be extended further, but as of today, this all expires on June 30th until otherwise notified. First, we'll talk about temporary reimbursement directives as given to us by the State Department of Education. The following reimbursement practices apply to all types of providers. So we're talking about all center-based programs, licensed family child care homes, and licensed exempt providers, or what we call family, friends, and neighbor. So regardless of the type of provider that you are participating on, while participating on the subsidy program, these apply to you during this crisis, again, up until June 30th. First one is that we are reimbursing both set schedules and variable schedules based on the maximum certified hours listed on each family certificate for child care services or the notice of communication, as you may otherwise note it. What that means is that if you have a certificate that reads 40 hours per week for each child, we are going to be reimbursing you based on 40 hours of child care being provided, even if you're not providing that care. For school-aged children, we will be reimbursing the same way as when they are on summer break, spring break, winter break. So as we know, schools are closed, kids are either at home or with their daycare provider during that time. So we are reimbursing full-time care if that's what you have been authorized for. So if you have a school-age child, typically it could be full-time during summer break, again, part-time when they're in school. During this time, you will be reimbursed full-time. Let's say you have a child who's only authorized 25 hours per week. That is what you will be reimbursed on, 25 hours per week. Backup providers and alternate providers will be reimbursed based on the actual care provided and as recorded on the child care attendance form. So for backup providers and alternate providers, there is no difference. You still will be reimbursed based on the hours of care that you provide, you will not be reimbursed for absences, okay? There is an exception to that, and we'll get to that in a minute. So one other thing that I wanted to clarify here is for backup providers, if the primary provider closes and the backup provider is providing more care than what they were originally authorized for, that may be okay as long as you let us know who is providing the care. So Again, if the primary provider closes, the backup provider is the one providing all of the care, we need to know that so that we can reimburse you properly. Continuing with other reimbursement directives. We need you to submit your March, April, May, and June child care attendance forms, even if you are not providing care. If you're not able to submit them, please talk to your provider services specialist. But there are different ways that you can submit your forms. You can mail them in. You can drop them off in the brown mailbox outside our front door. You can also fax them to us. You can scan them and email them to us. If you want to email them to us, please email them to info, that's INFO, at solanofamily.org. And we will get them to the provider services specialist. As long as they're legible, we will process those timesheets regardless of how we receive them. Child absences during this crisis are treated differently and may be reimbursable. So for any providers out there who are license exempt, typically, let's say grandma is taking care of her grandchild, during normal circumstances, if the child is absent, we do not reimburse for those days. During this time, through June 30th, if the child is absent, that's fine. The provider will still be reimbursed based on the maximum hours as stated on the child care certificate. Again, regardless of type of provider. Providers may submit a child care attendance form without the parent's signature. During this time, the parent's signature is being forgiven if it's due to the coronavirus situation. If this is the case, we ask the provider to simply write on the parent's signature line something to the effect that parent was unable to sign due to COVID-19, okay? As long as there's something there letting us know why the parent didn't sign, we will be able to process that timesheet. While the parent's signature is being forgiven, unfortunately, the provider's signature is not. So before you turn in your timesheets, we really need you to make sure that you, as the provider, sign each and every one of them. If we don't have a signature, the provider services specialist will call you to make arrangements to get that signature. As you know, our office is closed to the public, so the only way we're going to be able to do that is to mail you the certificate, the child care attendance form, have you sign and resubmit, and that's going to slow the process for getting you reimbursed, okay? So just make sure that the timesheets have your signature on them. Now we'll talk about when a provider is closed during this period. It is each provider's personal decision to stay open or to make the difficult decision to close their business during this crisis. If you have chosen to close your business, whether temporarily or permanently, please be sure to report that to Solano Family and Children's Services. Licensed providers must also report closures to Community Care Licensing at 707-588-5026 if you're being monitored by the Roanoke Park office, or 530-895-5033 if you're being monitored by the Chico office. Reimbursements, as stated on previous slides, will be made for up to 30 calendar days from the date of closure. So if the provider has any unclaimed days of non-operation, they may claim those DNOs after this 30-day period. In case there are license exempt providers listening to this webinar, typically DNOs do not apply because DNOs have to be part of the provider's business practices. Even licensed providers who don't submit their business practices to us or don't list days of non-operation on those business practices do not qualify for DNOs. But everybody, again, including licensed exempt providers, do qualify for up to 30 calendar days of reimbursement from the date they close. So we had a lot of providers who started closing on March 16th. If you're closed and that was your first day of closure, we will count out 30 calendar days from that date, including the 16th. And during that period, we will reimburse you the maximum authorized hours that you would normally have provided during that time. Okay? Again, all providers. Now we're going to talk about childcare for non-essential activities. In keeping with our county's shelter-at-home order, everyone should be staying at home with the exception of essential workers who cannot perform their jobs at home. I want to make this perfectly clear. There is no risk of a parent on our program losing their child care subsidy when they choose to keep their child at home during this crisis. We acknowledge that numerous parents have lost their jobs and may want to use childcare to look for work, given that there are many essential job openings at this time. And that is okay. You can, if we have parents on the program, or if you have, as providers, have parents on our program, and they want to continue using your services, it is okay for them to use you. What we ask is that while non-essential activities are discouraged during this crisis, subsidized childcare services can still be used as long as social distancing and other COVID-19 preventative health measures are being met. The best way to handle this is if you're not an essential employee, or if you're looking for work, or you're a student who is authorized for childcare services, and you're at home taking online classes and you need childcare during that time, the best way to handle that is if you could find somebody, a friend, a family, or neighbor who can take care of the child, because many of our licensed providers are opting to only care for children of essential employees. Now we'll talk about our recertification process during this time. Another point that I want to make perfectly clear is that during this time, we will not be terminating families from our program due to not being able to recertify their services during this crisis. We have already extended services for families who were or are due to be recertified between mid-March and May of this year. Depending on when our office is open for business again, we may need to extend those services out even further. The last thing we want to do is come back and have to recertify 200 families in a 1 month period. So what we will be doing is when we come back to the office, we may be extending more families out even further. What we're going to do when families are finally being recertified is that we will take into consideration that the recent check stubs may not reflect full-time hours due to being laid off or having a reduced work schedule. If that's the case, we will work with the parent. We want to make sure parents are feeling comfortable that they don't have to worry about this, because typically at recertification, their hours of approval for the next 14 months are based on their recent pay stubs. But we know what's going on, and we will make sure that parents are receiving the services that they are entitled or eligible to receive. Now we'll talk about family fees. And I'm going to take a minute here to really explain that this section is in reference to family fees only and has nothing to do with parent copays. Parent copays happen when the provider of choice charges more than what we can reimburse them. We have the regional market rate ceilings, that guide how much we can pay, reimburse a provider. And if a parent chooses a provider who charges more than that, that creates a copay, creates an out-of-pocket cost to the parent. The parent is supposed to pay that to the provider. We don't get involved in that arrangement. We don't follow through to make sure that the parent is paying, but it is an arrangement that is strictly between the parent and the provider. What this section is going to be talking about is family fees. And the family fees are based on the parent's gross monthly income and the certified need. So families who have to pay family fees are notified, and the provider who is supposed to collect the fee is notified as well. That is what we're going to be talking about in this section. So family fees for the months of April, May, and June of this year have been waived and are not to be collected. Family fees for March and prior months are not waived. They will not be credited or refunded, and they are to be collected by the provider. So the parent has to pay those fees. Parents who pay family fees for the months of April, May, and June, we ask that they do not pay the provider. The fees will resume as assessed and scheduled on July 1st, 2020, unless otherwise notified. And this is a full waiver. This is not a deferment. This is, you will not have to pay for these months at all. The note to providers here is, again, on the flip side of that, for April, May, and June, please do not collect family fees from your subsidized childcare families. We will not deduct any family fees from your reimbursement for these months. But I do want to make it perfectly clear that right now, we are processing March and prior months of service. So the reimbursements that providers are receiving still reflect a deduction for family fees that should have been collected for March and prior months. The reimbursements we begin to process in May for April services is when you will first see that we are not deducting family fees. So in May, we're reimbursing for April, no family fees should be deducted. Same for June, reimbursements for May, and July reimbursements for June. None of those months should you see a family fee being deducted. And none of those months should you be collecting a fee from the family. We continue with family fees. Now we're talking about delinquent family fees. How does a family become delinquent in their fees? Basically, a family is supposed to pay on the first of the month a flat monthly fee to their provider for the services they expect to receive in that month. Okay. Sometimes families don't have it, they fall behind. That becomes a delinquent family fee situation. So in these cases, what the state has asked is that parents who are behind on paying their family fees for the month of March and prior, that they not be expected to pay these fees until after July 1st. Therefore, we will not be taking action against any parent for not following through with their delinquent fee payment arrangement. If a parent would like to continue paying on their delinquent fees between now and June 30th, they may do so. So what happens after July 1st? Again, we acknowledge numerous parents have lost their jobs or have had their work hours reduced. As a reminder to all parents, whenever an enrolled family's income goes down, the parent may request a reduction to their family fee in these cases. We will recalculate the family's adjusted gross income. And if that yields a lower family fee, we will adjust the amount due without changing the certified hours of care. One has nothing to do with the other. A note here is that as we cannot pay for tutoring services, and we want to make sure parents understand that in-home provider rules are still restrictive as domestic employment laws have not changed during this crisis. So the question that was posed to us was, I'm working at home, my kids are home, I can't do my work and help them with their homework or their distance learning schedule. Will SFCS pay for me to hire somebody to come into my home to tutor my kids? Unfortunately, that is not childcare, and that is not something that we can reimburse. Okay, now we'll talk about childcare services for essential workers during COVID-19. On April 4th, Governor Newsom issued an executive order that has made childcare subsidies available for essential workers. During the COVID-19 crisis, okay, if any of you were listening to this yesterday, or if you go back and watch the video after we posted next week, you'll see that this slide was different. This is how fluid the information and the directions are happening. This morning, we received our contract for this emergency childcare services for essential workers. We found out that based on our contract, we will be able to serve at least an additional 400 children of high risk and essential worker families. This funding will pay for childcare services through June 30th only. 12-month eligibility will not apply for these new families. We're asking you to help us get the word out. If you know of essential workers in our community who can benefit from this service, please refer them to us as we are preparing to enroll families as soon as next week. Again, temporary service. As soon as we get a signed application from them and they've chosen their provider, we will start reimbursing for services. And it only covers them until June 30th. Unless, of course, these directives are extended. Also, there are licensed family childcare homes and centers that are still open and making spaces available to essential workers. Families in need of childcare providers can contact us by calling us at 707-863-3950, extension 709, or by going to our website at www.solanofamily.org. They can complete the childcare referral form to receive a list of licensed childcare providers with openings. That does it for us in the subsidy department. We're going to pause here. Feel free to chat your questions and enjoy this music, and we'll be right back with you. Okay, we have a few questions. The first one is, the person stated, I'm assuming FSSs have limited in-office hours. If you have a new subsidy parent that wants to enroll and you need a verbal approval same day, is the worker able to retrieve messages and give verbal approval from home, or should parents be directed to leave message for front desk general phone number? Yes, we do have staff in the office on a limited basis, but they are working from home as well when they're not here. So the parents should always call their family services specialist, leave a message. We've directed staff to check their voicemails at least mid-morning and mid-afternoon every day, check their emails mid-morning and mid-afternoon every day, get back to those parents and providers. If it's something they can't do for them from home, if they can't resolve the issue from home, then they are to email the soup group here on site, and that work is being assigned to whoever is in the office that day. So we're trying our very best to make sure that there is no lag in services and that there's no interruption in services. Next question. Two questions, and they're kind of related. I'll read them off so that you know I'm addressing you. First one is, if you have a child that is approved max 60 hours per week, does this mean that 52.5-hour adjustment is applied, even if not attending, as long as it's in the provider's rate? And the next question is, children that are in care, are they being reimbursed the maximum hours as well, even if they are not here for maximum hours? So yes, again, this does apply to all provider types, including exempt providers, and we are reimbursing based on the max that it appears on the schedule. So the first question about the 60 hours, will we pay the 52.5-hour adjustment even though the child's not there? The answer is yes. And then the second question, the child's not attending, am I going to get reimbursed the maximum hours? The answer is yes. This is costing a lot of money for the state, which is why when a provider closes, we are only able to reimburse up to 30 days, because in those cases, we're making dual payments. If the parent still needs care, one provider is closed, we're paying that provider based on the max hours that they would have been providing care, and at the same time, the parent's still using somebody else, we're paying that person as well. Next question. In order for a family of an essential worker to qualify for funding, do they have to be income qualified? So there's a long list of priorities for this funding. The first priority goes to children who have an open CPS case, and then children who are at risk of abuse and neglect. Then it goes to Bridge families. Bridge is a program that provides emergency child care for foster families. Then we have children of families who are homeless and seeking permanent housing. Then there's children who have special needs. There's, actually, that's not the next priority. The next priority is for essential workers. And in that group, there are at least 3 priorities. The first priority goes to parents who are in the healthcare industry and first responders. And then the next list is parents who, other essential workers, like parents who work at grocery stores, gas stations, etc. Then there's a category for serving children who have special needs, and child development services is part of their IEP plan or their IFSP plan. So all of those essential workers, after we serve the high-risk families, the CPS, at risk, seeking housing, when we get to the essential workers, the first level is based on income eligibility. So the parent has to qualify by meeting their income can't exceed the 85th percentile of gross the state median income. Then, after we've served all those children, then we can open it up to families who are essential workers and whose income exceeds the 85th percentile of state median income. Now, as I mentioned earlier, we're estimating that we can serve at least 400 children, right? So If we serve everyone and we still have slots, then we will be able to enroll those families who exceed the 85th percentile. So how far we get down that list, because we have over 1,000 children on our waiting list, is anybody's guess. We're going to have to take it day by day. And I think that's all the questions I see for subsidy. We're going to see if Cinda is back on to see if she has any questions to answer.
I do. This is Cinda. I do have a couple of questions. So one question is, how do you know if you've received our update and as far as what openings we have? I want to clarify too, as far as updating, we will be calling providers more often. We have received notice from Department of Education to update with providers weekly, to have an ongoing update of what vacancies you have at the time, so that we are giving accurate information to parents at time of referral. And as Diana mentioned, there are many families and children that will be enrolled. So you can imagine how, again, fluid that information will be. So we will be in contact with you if you feel like you have updated but are not sure that we have received it. You can call our update line again at 707-863-3950, extension 709, and leave us a message, and someone will return your call and let you know that if we have it or not, and if you still need to update. Another question, so providers who did not update by 5 p.m. today were automatically taken off referral list, or do we have until tomorrow morning? Most likely you have been taken off of the referral list. However, if you update with us, we are accepting updates all the time. So I would just recommend that you send us an update as soon as possible. If you send it through over the weekend, we will definitely have it by Monday, and we'll process it Monday. Another question was around what supplies, cleaning supplies, are being offered. So right now we have gallon-sized Clorox bleach, hand sanitizer, some Clorox foaming spray, the nitrile gloves, medium and large, and assorted cloth face masks. And we are on the survey also asking about disinfectant wipes, hand soap, toilet paper, paper towels, and Lysol spray. So again, we do have a limited supply right now, but we'll be looking to purchase more items. Diana, I think that is all the questions for R&R.
So, first question. I didn't put a reason for no signature on parents' line. This is in regards to attendance forms. Will it be okay? Yes, it will be okay. If there's no reason on there, then we would call the parent and the provider to confirm that it's COVID-19 related, and we will, again, forgive the signature. Next question. So when we fill out the forms, we just put A on all days for all the kids. Is that correct? When a child is going to be absent long-term, so let's say the child was absent half the month of March, the end of March. All we ask you to do is put one line diagonally crossing, those days. On that one line, just one time, write absent on the front. On the back, you put the date range, one line explanation as to why the child was absent, be as simple as COVID-19, and you're good. If the child is absent the full month, line through both sections, because as you know, half of the month is on one side, half of the month is on the other. Just one line diagonally on both of those sections. Just write absent on the front, on the back, the full month absent due to COVID-19. That suffices. Next question. I know that there is no new regulation on subsidy parents using childcare for non-essential activities, but CCL is telling, community care licensing, is telling providers that no child should be in group care unless absolutely necessary and if essential. This creates discrepancy between subsidy guidelines and community care licensing guidelines. Can we have some clarification on this issue? Thanks. Yes. So again, the operative word there is should. Providers should only be caring for children of essential workers. It does not say must only be. It's not a directive. It's not a mandate. It is a good suggestion. As I said earlier, we should all be sheltering in place, but nobody is saying, nope, as a provider, you cannot care for children of non-essential families, and nobody is saying to parents, nope, sorry, you're authorized for childcare, but you can't use it during this time. None of the lead agencies will take that stance, so we have nothing to sink our teeth into. So therefore, it's up to the provider discretion to accept the child or not. In fact, a recent management bulletin that came out from CDE actually talks about children, basically, if a provider, actually it's about these essential workers. We are to inform our families that only, providers or children of essential workers should be in childcare. But the management bulletin states that once you inform the family, if the family still brings the child, that we are to presume that they are essential workers. We're not asking, we're not policing. We're just informing parents, but if they choose to continue to use childcare, they are eligible to do so. It's on each provider to make their own decision as to whether or not they're going to care for children of non-essential workers. Okay, I believe there's one more question. I'm concerned that early Head Start childcare provider partnerships or partners, more than 50%, approximately 12 providers that are currently closed, will be asking Head Start to cover the subsidy costs if they stay closed during the length of the shelter at home. If after the 30 days that SFCS is reimbursing closed providers, a subsidized family does not want to return to their provider, why doesn't that funding go to the provider until June 30th to secure their slot? So the rules and all of these directives were very clear that when a provider is closed, we can only cover the first 30 days, up to 30 calendar days. Actually, it's not even 30 business days. 30 calendar days. And the reason, again, for that is most likely if the parent is going to use another provider because the primary provider is not closed, then that creates a dual payment. And as I said earlier, it's very expensive. Our average cost of care has gone up for these families from an average of $650 a month to almost $1,000 a month. So the costs are skyrocketing really quickly, and the funding is limited. Again, we're just following the directives that are issued to us by the State Department of Education. And I believe that's all the questions we have. There's a follow-up question, hold on. The question is, why not take the stance if schools have denied children from attending school? Again, not our call. Parents are authorized for 14 months of care. During that 14 months, we do not control what the parent is doing during those months. We have parents that once they're certified, they might be certified for employment, they lose their job, they're looking for work. If they were authorized at initial certification or recertification, if they were authorized 60 hours of care because they were working full-time and commuting to San Francisco, and suddenly they lose their job, and now they're looking for work, they can continue to use care for 60 hours a week. We have no control over that. That's all driven by regulations. So by that same token, because the parent has been pretty much guaranteed, to put it in other words, childcare for 14 months, we can't cut that short for any reason. The only time we can cut it short is if the parent chooses to have us reduce their hours of care, or if they choose to be terminated from the program, or if they choose to take a leave of absence, or if they income out, or if their child is no longer age eligible. But while they're eligible, they can use care for whatever they want, and we cannot deny them. Okay? Okay, another question. I just want to clarify. So you guys are paying 30 calendar days, not 30 business days. We will pay up to 30 calendar days, and only for the days that are covered by the certificate. So let's say the certificate states that child care services are approved Monday, Tuesday, Wednesday only. We start on the first day that the provider closed. We count out 30 days, including that day. And however many Mondays, Tuesdays, and Wednesdays fall in that is what we will reimburse. It is not based on business days, and it is not based on the days that the child would have been in care. It's calendar days up to 30. Okay, I think that's it. So now what we're going to do is we're going to open up the lines for the people who are on phones.
Okay, thank you very much. Hi, my name is Maisha Bell. I'm one of the providers in the Vallejo area. I just wanted to actually make a comment to you guys during the web seminar that everything, all my questions was answered. Everything was very informal regarding the food program and everything else, and regarding providers who have closed up due to the coronavirus, and also for the providers that have stayed open due to the coronavirus. So I just want to acknowledge you guys and just appreciate everything you guys are doing tonight, and just to let you know that we're all in this together, and I appreciate you guys really a lot.
Well, thank you so much for those comments. We appreciate you.
Okay, good. Okay, so, and just like the previous provider said, like, first of all, thank you for all of the support. I know I talked to a lot of providers, and a lot of them are feeling very supported, even though you guys have right now limited hours and staff are working from home. we get our questions answered, and staff is being very diligent with that. I just have a question again about the extra funds that are coming in that can serve an additional 400 children. So I have a private pay parent who I'm pretty sure could benefit from this. She is an essential worker, but definitely would probably fall above the income guidelines, but her child has a special need. He's diagnosed with autism. So I'm wondering if in that last category, is special needs listed as a priority in that last category of parents who are over the income?
So actually, families with children who have special needs are listed above that. So they can be within the income guidelines or outside of them.
Okay.
If that's but that's if that's their need for services, that would come into play.
Okay.
If the parent
Okay.
is, you said it's the parent's an essential worker, so the need would be working, not
Yeah.
child development.
Yeah, she is working. She definitely is working.
So yes, so please refer the family to us. We'll put them on the waiting list. And if we have the extra funds to serve families above the income ceiling or the income eligibility guidelines, then we will serve them.
Okay, perfect. Thank you.
Thank you. That does it for us.
Thank you, Diana. I want to just give a big shout out to all the managers and supervisors and staff that are here tonight who made all of this informational webinar possible. And certainly the dynamic duo of Ray and Diana, who are still at the office trying to make all the technical pieces and parts work. Otherwise, we're all talking from our homes. And I'm very proud that we were able to get this done tonight and share this information. And I want to thank all of you for participating, asking your questions. Please don't stop asking your questions. Keep communicating with us. Keep letting us know if you're missing some information. Our staff are very eager to make sure that they're giving you the information you need. They want to make sure that they're meeting all of our responsibilities to keep everybody informed. So, please keep checking back on our Facebook page, check our website, and if you don't see something, please give us a call. The other thing I want to say is that while many of us are working from home, some of us come into the office part of the week. Cinda mentioned that we're getting some supplies now, so we're going to try and figure out how to get things to people or have people pick them up. And so we'll be working with you on that, and we appreciate your support. I also want to thank you for what you're doing. Thanks for staying safe. Thanks for following the rules. Thank you for providing essential childcare and support to the community during this time. At SFCS, we've always known you as childcare providers have always been essential. That's not new. That word has always been there for us, and we understand it very clearly. And so thank you for what you're doing. And I know you've all had to make some tough decisions, and we're right there with you. And we hope that we can all get through this, and that soon enough we'll be face to face together, and we can continue on working together and supporting the families that you serve. So thank you again for coming this evening on a Friday night. What else did you have to do, right? So thank you again, and keep us informed, and we'll continue to talk with you. I hope you have a good evening. Thank you.